Your liver could be speaking while you sleep. Are you listening? It starts quietly. You wake up in the middle of the night, heart racing, drenched in sweat, or with a strange pressure in your legs. You toss and turn, hoping to fall back asleep, but something just feels off. It's easy to blame a bad dream or a stressful day. But what if your body is trying to tell you something deeper, something your liver has known for a while? While you sleep, your liver is hard at work, processing toxins, balancing hormones, managing blood sugar, and supporting over 500 critical functions. But when it's overwhelmed, those quiet efforts start to slip. And long before any lab test sounds the alarm, your body may already be showing signs, at night. According to a 2023 report from the International Liver Health Foundation, nearly 1 in 3 people with early-stage liver dysfunction experience their first noticeable symptoms during sleep. That includes everything from unexplained insomnia and muscle cramps to itching skin, nausea, and dark-colored urine. In this video, we're going to explore 8 specific nighttime symptoms that may be early indicators of liver trouble. Because when your liver is struggling, it rarely shouts, but it never stays silent. If any of these signs sound familiar, this might be the most important video you watch today. And if you've had similar experiences, we'd love to hear from you in the comments below. You're not alone, and your story might help someone else start listening to their own body before it's too late. 1. Dark urine. Have you ever woken up in the morning and noticed that your urine has a dark, tea-like color? While it might seem like a minor issue, dark urine can be a significant warning sign of liver problems. Unlike occasional changes in urine color due to certain foods or medications, persistent dark urine should not be ignored, especially when accompanied by other symptoms. This discoloration occurs when there is an excessive buildup of bilirubin in the body, a byproduct of the liver's process of breaking down old red blood cells. When the liver is impaired and cannot effectively process bilirubin, it spills over into the bloodstream and is eventually excreted through the urine, giving it that dark hue. Dehydration can also contribute to dark urine by concentrating the urine and making the color more intense. Additionally, certain medications that are metabolized by the liver can impact urine color, either as a side effect or due to the liver's reduced ability to process these drugs properly. Beyond the dark urine itself, you might experience other associated symptoms, such as unexplained fatigue, which occurs because your body is struggling to remove toxins efficiently. Abdominal discomfort or pain, particularly in the upper right side where the liver is located, can also accompany dark urine, indicating that your liver is under significant stress. Managing dark urine involves taking immediate and proactive steps to protect your liver health. If you notice persistent dark urine, seek medical attention right away to rule out serious liver conditions and receive appropriate treatment. Limiting your exposure to toxins, such as avoiding alcohol and being cautious with medications, can help reduce the burden on your liver. Additionally, staying well hydrated by drinking plenty of water helps dilute your urine and supports your liver in flushing out toxins more effectively. By addressing these factors, you can help maintain your liver health and prevent further complications. 2. Waking up with nausea. Have you ever been jolted awake by a sudden wave of nausea, leaving you with a sour taste in your mouth or an unexpected need to spit out excess saliva? This unsettling experience can be more than just a random discomfort. It might be a sign that your liver is struggling. Waking up with nausea at night can disrupt your sleep and leave you feeling unsettled and drained the next day. Unlike occasional queasiness, persistent nighttime nausea is a symptom that warrants attention, especially when linked to liver health. The connection between liver disease and nighttime nausea is rooted in the liver's critical role in digestion and toxin elimination. When the liver is not functioning optimally, toxins begin to accumulate in the body, which can interfere with various digestive processes. One key issue is the disruption of bile flow. Bile, produced by the liver, is essential for breaking down fats and aiding in the absorption of nutrients. Impaired bile flow can lead to digestive inefficiencies, causing feelings of nausea. Additionally, the buildup of toxins can directly affect the gastrointestinal system, leading to increased stomach acidity and discomfort. This imbalance not only disrupts digestion but also contributes to acid reflux, which can exacerbate feelings of nausea, especially when lying down to sleep. As a result, individuals with liver dysfunction may find themselves waking up with an uneasy stomach, struggling to get comfortable and restful sleep. Managing nighttime nausea involves a combination of medical guidance and practical lifestyle adjustments. First and foremost, seek medical advice to properly manage your nausea and address any underlying liver issues. Elevating the head of your bed with extra pillows can help reduce acid reflux by keeping stomach acids from rising into the esophagus while you sleep. Additionally, follow any treatments or supplements recommended by your healthcare provider to support liver function and alleviate digestive discomfort. By taking these steps, you can better manage nighttime nausea, improve your sleep quality, and support your overall liver health. 3. Night sweats. It always starts the same way. You drift off to sleep feeling perfectly normal, only to jolt awake hours later, drenched in sweat, your clothes soaked, your sheets clammy, your heart racing. You're not hot. There's no fever. And the room isn't even warm. Yet night after night, this cycle repeats itself, and you're left wondering, what is happening to my body? What if those night sweats weren't random? What if they were your liver's early warning flare? While many associate sweating during sleep with hormonal changes, medications, or stress, research from the European Liver Foundation now suggests that over 30% of patients with chronic liver stress report unexplained night sweats as one of the first subtle symptoms, long before lab tests reveal abnormalities. Your liver is one of the hardest working organs in your body. It filters over 1.5 liters of blood every minute, breaks down toxins, processes hormones, and regulates metabolism. When it's overburdened, whether by poor diet, alcohol, medication overload, or undiagnosed disease, this silent workhorse begins to falter. And the first system it throws off? Your internal thermostat. That's why seemingly harmless sweating can become a clue to something far more serious. If you've been waking up soaked, exhausted, and unsure why, don't dismiss it. It might be your liver trying to speak through sweat, discomfort, and disrupted sleep. 4. Restless Leg Syndrome, RLS. You're lying in bed after a long day, hoping for a quiet night. But just as you begin to drift off, a strange sensation creeps in. Your legs feel like they need to move, right now. The more you resist, the worse it gets. You stretch, kick, shift positions. No relief. Hours pass, sleep slips away, and when morning comes, you're exhausted again. This is restless leg syndrome, or RLS, and if it happens more often than not, your liver might be the hidden culprit. In a 2022 clinical review by the American Journal of Neurology and Hepatic Health, researchers found that nearly 1 in 4 patients with chronic liver impairment reported frequent symptoms of RLS, particularly at night. The reason lies in a toxic domino effect. When the liver can't effectively clear waste from the blood, these toxins begin to damage peripheral nerves, especially in the legs. This nerve damage causes the mixed-up signals that lead to crawling, tingling, or jolting sensations, creating the relentless urge to move. But there's more. Liver dysfunction also disrupts your body's levels of iron, magnesium, and B-complex vitamins, all essential nutrients for healthy nerve transmission. And it doesn't stop there. Low iron, for example, has been directly linked to worsened RLS symptoms. A recent double-blind trial found that participants who increased their ferritin levels above 75 nanograms per milliliter experienced a 51% reduction in nighttime leg restlessness within 4 weeks. So how can you find relief? Start with your plate. Load up on iron-rich foods like lentils, tofu, spinach, and pumpkin seeds. Add magnesium from chia seeds and almonds, and make sure you're getting plenty of B12 and folate from fortified cereals or supplements. Ditch the alcohol. It not only stresses your liver but also worsens nerve sensitivity. Stick to a regular bedtime, practice deep breathing, and sip calming teas like chamomile before bed. And most importantly, listen to your legs. They're not just fidgety. They might be warning you that your liver needs care before the symptoms move from your feet to your whole body. 5. Frequent urination. Have you noticed yourself waking up multiple times during the night to use the bathroom? While occasional trips to the restroom are normal, frequent nighttime urination, known as nocturia, can be more than just an inconvenience. It might actually be a sign that your liver is struggling. Persistent nocturia can significantly disrupt your sleep, leaving you feeling tired and irritable the next day, and it's important to understand the underlying causes to address this symptom effectively. The connection between liver disease and frequent urination lies in the liver's role in managing fluids and detoxifying the body. When the liver is not functioning properly, it can lead to fluid retention in various parts of the body. To compensate, your kidneys may increase urine production to help eliminate the excess fluid, resulting in more frequent trips to the bathroom, especially at night. Additionally, liver dysfunction can cause hormonal imbalances that affect the body's diuretic processes, further contributing to increased urine output. This imbalance disrupts the normal regulation of fluids, making it harder for your body to maintain a stable fluid balance, and consequently, you may find yourself waking up repeatedly to urinate. Managing frequent nighttime urination involves a combination of lifestyle adjustments and medical consultation. Start by limiting your fluid intake in the evening to reduce the need to urinate during the night. Avoid consuming caffeine and alcohol in the hours leading up to bedtime, as these can act as diuretics and increase urine production. It's also essential to consult with a healthcare provider to assess your liver function and determine if there are underlying issues that need to be addressed. By taking these steps, you can help minimize nighttime disruptions and support your liver health. 6. Nighttime muscle cramps. It's 2:13 a.m., you're fast asleep, and then, bam, a searing pain explodes in your calf like a lightning bolt. Your leg stiffens, your toes curl involuntarily, and all you can do is gasp and clutch at the sheets. Sound familiar? These middle-of-the-night muscle cramps aren't just painful, they're a signal. And if they're happening often, your liver may be trying to tell you something important. According to a 2023 study published in the Journal of Clinical Hepatology, nearly 35% of patients with early-stage liver dysfunction reported recurrent leg cramps at night, especially in the calves and feet. The reason? When your liver is under stress, its ability to regulate electrolytes, especially magnesium, potassium, and calcium, starts to decline. These minerals are essential for normal muscle contraction. Without them, your muscles misfire, spasm, and lock up. But it doesn't stop there. A struggling liver also leads to poor blood circulation and a buildup of metabolic toxins in your bloodstream. These toxins interfere with how your nerves and muscles communicate, making cramps not only more frequent but more intense. So what can you do? First, focus on your nutrition. Add magnesium-rich foods like pumpkin seeds and spinach, potassium powerhouses, like avocados and sweet potatoes, and calcium from tofu, almonds, or dark leafy greens. A recent trial found that participants who increased magnesium intake by just 100 milligrams per day saw a 42% reduction in nighttime cramps after 4 weeks. Next, avoid alcohol and overly salty foods, which deplete your mineral balance even further. Keep a bottle of water by your bed and stay hydrated, especially if you sweat at night. Before sleeping, try gentle stretches, especially hamstring and calf stretches, to keep the muscles supple. And if a cramp hits, sit up, massage the muscle with steady pressure, and apply warm compresses. But more importantly, ask yourself why it's happening. Sometimes the loudest warnings come in silence, or in the middle of the night with a scream in your leg. 7. Insomnia. Another critical nighttime sign of liver disease is insomnia. Imagine lying awake for hours, unable to drift off, or waking up multiple times throughout the night, leaving you feeling frustrated and utterly exhausted the next day. This persistent struggle with sleep can affect every aspect of your life, from your mood and concentration to your overall health and well-being. Unlike occasional sleepless nights, insomnia related to liver issues tends to be chronic and resistant to common remedies, signaling that something deeper may be wrong with your liver function. The root cause of this insomnia lies in the liver's inability to effectively filter out toxins from the bloodstream. When liver dysfunction occurs, these toxins accumulate and can interfere with brain function, disrupting the natural sleep-wake cycles. Additionally, liver problems can lead to hormonal imbalances, particularly affecting melatonin and serotonin levels, which are crucial for regulating sleep patterns and mood. Melatonin helps control your sleep cycle, while serotonin influences both mood and sleep. When these hormones are out of balance, it becomes much harder to fall asleep and stay asleep, creating a vicious cycle of poor sleep and worsening liver health. Managing insomnia related to liver disease involves a multifaceted approach. First, seek medical advice if you experience persistent insomnia to rule out liver disease and receive appropriate treatment. Establish a calming nighttime routine, such as reading, taking a warm bath, or practicing yoga, to help signal to your body that it's time to wind down. Maintain a consistent bedtime schedule to regulate your internal clock. Reduce screen time at least an hour before bed to minimize blue light exposure, which can interfere with melatonin production. Lastly, ensure your bedroom is dark, quiet, and comfortable to create an optimal environment for restful sleep. 8. Itchy skin. One of the often overlooked nighttime signs of liver disease is intense itching, also known as pruritus. Imagine lying in bed, trying to get some much-needed rest, but being constantly interrupted by an overwhelming urge to scratch your skin. This persistent itching can make it incredibly difficult to fall asleep or stay asleep, leading to fatigue and a decline in overall quality of life. Unlike ordinary skin irritation, this type of itching is typically widespread and not confined to any specific area of the body. The primary cause of this relentless itching lies in the liver's impaired ability to filter toxins from the blood. When the liver isn't functioning properly, bile salts, which are normally processed and excreted, begin to accumulate in the bloodstream. These bile salts can deposit in the skin, triggering the itch receptors and causing the uncomfortable sensation. Additionally, other substances that the liver usually clears, such as histamines and bile acids, may also contribute to the itching by irritating nerve endings in the skin. Managing this uncomfortable symptom involves a combination of skincare and medical interventions. Start by using high-quality, fragrance-free moisturizers to keep your skin hydrated and reduce dryness. Taking lukewarm showers instead of hot ones can help prevent the stripping of natural oils from your skin. Applying anti-itch creams that contain ingredients like menthol or calamine can provide temporary relief from the itching. It's also important to consult with a healthcare provider, as they may prescribe medications that can help manage the symptoms more effectively. Additionally, keeping your bedroom cool and wearing breathable, loose-fitting pajamas can create a more comfortable sleeping environment, minimizing the urge to scratch and helping you get the restful sleep you need. Your liver doesn't just work during the day, it works hardest when you rest. And sometimes, the signs that it's struggling don't show up in blood tests first, they show up in the middle of the night. From persistent itching and restless legs to night sweats, muscle cramps, and dark-colored urine, your body could be whispering that your liver is in distress. These aren't just sleep disturbances, they're silent alarms you can't afford to ignore. By understanding and recognizing these nighttime signals, you're not only protecting your sleep, you're giving your liver the attention it deserves. Small changes in diet, lifestyle, and awareness can make a massive difference in how you feel each morning. If this video helped you connect the dots between your nighttime discomfort and liver health, don't keep it to yourself. Hit the like button, share it with someone who might need it, and make sure to subscribe for more science-backed insights that empower you to take control of your health, day and night. Thank you for watching, stay well, and sleep peacefully. See you in the next video.